Welcome to the Medical Cost Finder portal, which allows eligible specialists to securely participate in the Medical Cost Finder. The Medical Cost Finder is an Australian government website developed by the Department of Health and Aged Care. It was designed with doctors to give patients early and reasonable expectations about their private healthcare experience and support out-of-pocket costs transparency. The department worked with medical professionals nominated by their medical colleges to identify appropriate in- and out-of-hospital medical services for which specialists can provide information in this portal. Specialists can visit the portal help page to find out if their specialty is open on the portal. They can also view the list of services against which they can publish indicative fees. More specialties and services will become available over time. In this video, I'll demonstrate how to use the portal, starting with registration, which only takes a couple of minutes. Skip ahead to see how to onboard a first service, use the dashboard, or find resources for specialists and practice staff. Let's get started. This is the portal landing page, where I can log in using either my Proda account or my digital identity. If I was logged into Proda, I'd look for the Medical Costs Finder portal tile and click on it to access the portal. Today though, I'll log in with my digital identity. I've downloaded the MyID app on my smartphone and set up my digital identity with a strength of at least standard. I have the app handy and ready to go. To log in, I'll enter the same email address that I used to register with MyID. When the code appears on the screen, I'll open the MyID app on my phone and enter the code. Because this is my first time logging into the Medical Costs Finder portal, I have to consent to sharing my identity details. I can ask the system to remember my choice, so I don't have to do that every time I log in. I'm now in the portal and ready to register an account. To register, I can use my APRA number or the first 6 digits of my Medicare provider number. Today I'm registering as Dr. Alex Reston. I'll use my APRA number, and I'm an ophthalmologist, so we'll select that as my specialty. I'll tick the box to consent to the website terms of use and privacy notice, and select register. If something goes wrong and I get an error message, I can make 2 more attempts to register before the system will lock me out. If this happens, I can get in touch with the Medical Cost Finder Contact Centre on 1800 318 210 or email mcf portalsupport@health.gov.au and they'll work with me to resolve the issue. Now that I've registered, I can choose to nominate an authorised representative to complete the next steps and manage my account. That person will be able to update my information, manage my account, and approve content updates for publishing on my behalf. I can add other authorised persons later if I wish. Today I'll invite Catherine, my practice manager. I've gained Catherine's consent to enter her details into the portal, and I must use her unique MyID or Proda email address. Once I've done that, I'll click Invite. Catherine will receive an email with her invitation code, which she can use to register as an authorised representative. The invitation code is valid for 30 days. If Catherine doesn't register before it expires, I'll need to send another one. So, now I'm registered. I can stop here and ask Catherine to complete the next steps, or I can select Next to continue with onboarding and create a profile that will appear on the Medical Cost Finder website. To create my profile, I'll start by entering my title and display name. These are mandatory fields, as they will appear on the Medical Cost Finder website. Most people know me as Lexi, so I'll use Lexi Reston as my display name. I'll add my 16 to 20 years of experience from the drop-down list. I'll also add my fellowship and my qualifications. Next, I'll add my contact number. This phone number and email address won't be published on the website. They're for the department to use if they need to contact me about my account. The next step is to add a primary practice location. At the onboarding stage, I can only add my primary practice address, and this should be an out-of-hospital location. I can add more in and out-of-hospital locations later. I want to make sure my website is linked to my profile, and I'll enter that here so people visiting the Medical Costs Finder can get to it easily. Once I've completed the information, I'll select Publish and go on to add my first service. For my first service, I'll add Initial Ophthalmology Appointment. To see the bulk billing rate, I can click Calculate based on bulk billing, which will show the Medicare payment amount for this service. I can choose to publish this bulk billing amount of $183 to the website, or I can use a different indicative fee. I charge $200 for an initial ophthalmology appointment, so I'll enter that amount. At this stage, I want to preview how this information will look on the website. I'm happy with that, so I'll go back to the first tab and select Confirm to publish my profile. Clicking OK will take me to the portal dashboard. I can stop here or add additional locations, services, and insurance providers. To add a new location, I'll select Dashboard in the menu and click Add Location. I want to add a hospital location. To find it, I'll click on the magnifying glass and search for it by location name or filter by state. Now that I've found it, I'll click Publish at the bottom of the screen. The system is now asking me if I want to link services to this location. If I wasn't ready to do that, I could select No and do it later. But today I do want to link a service, so I'll select Yes. I've now arrived at the page where I can add one or more services. If I had already entered indicative service fees at another location, I could copy that information across by clicking the button Copy Details from Existing Location. I haven't done that, so I'll select the service I want to add from this list. If I had a few services to add, I could select and add them all in one go. Today I want to add my indicative fees for cataract surgery, so I'll find it in the list. I'll then enter the indicative fee I charge for a cataract surgery at this location. To add gap arrangement information, I'll click Add Provider and tick Select All. If I had arrangements that differed between insurers, I could add them separately. If I offer a no gap arrangement with any insurers, I can tick this box here. For a secondary location, I can also choose not to add a fee by checking this box. This will be useful if I practice across multiple locations but don't want to enter fee information for each one. Having this on the website shows patients where they can access my services so they can contact the practice for more information. Once I've entered all the information I want to add for this location, I'll click Publish and review my entries. I can also preview how it will appear on the website. After I've published, I'll be taken to the Location View page. If I want to return to the dashboard, I can do so by clicking Dashboard. From the dashboard, I can edit a service at any time by clicking on the service name. Then, on the Service View page, I'll click Edit this service to change the indicative fee and gap arrangements at any time. To remove a service, I can select the service, then click on Stop displaying this service. This will remove the service from the website. If I want to remove a provider, I'll select View from this part of the dashboard drop-down and click on the Remove this insurance provider button from the View page. This will remove all existing arrangements with this insurance provider. From the dashboard, I can also edit my public profile to add more information about my skills and experience and how I work. I specialise in macular disease, so I'll include that under Areas of Expertise. I also speak Greek, so I'll add that in the Languages You Speak section. I'm a member of the Australian Society of Ophthalmologists, so I'll add that under Memberships. I could also add teaching practices and other information related to my skills and experience. I also want to show that I participate in my health record and offer telehealth services. Lastly, I can choose to invite other practice staff to help my authorised representative, Catherine, keep my accountant profile up to date. To do that, I would click on Authorised Persons in the menu and add the details of the staff I want to invite. Support staff can update my profile, but changes can't be published without approval from me or my authorised representative, Catherine. The Medical Cost Finder portal help page has resources and information for participating specialists. For each open specialty, there's a resource that lists the services for which specialists can provide indicative fee information. A one-page specialist starter kit offers a quick reference guide to registering and onboarding in the portal. More in-depth instructions can be found in the full portal user guide document. There's also a frequently asked questions document specifically for specialists. For technical issues and troubleshooting, the Medical Cost Finder Contact Centre is available on 1800 318 210 between 8:30am and 5pm weekdays. Outside those hours, please send an email to mcfportalsupport@health.gov.au and a contact centre officer will get back to you as soon as possible. Specialists and staff can go to the Medical Cost Finder website at any time from the portal dashboard. The website has a dedicated page for specialists with links to the portal terms of use, privacy notice, and a range of other helpful information. Thanks for participating in the Medical Cost Finder.